Good afternoon, everyone. I'm Luke Tannen, President and CEO of Chicago Innovation, and I want to welcome you all here today to the Future of Health. And to kick things off, I am here alongside with Tom Kuzmarski, the co-founder of Chicago Innovation and the president of innovation consulting firm Kuzmarski Innovation.
Thanks, Luke. Hey, welcome everyone today. Can you think of any topic that's more important than our future health? Oh my gosh, I can't. When I started Chicago Innovation 20 years ago, I've seen Chicago truly rise as a leader in healthcare, whether it's from big corporations like Abbott and Walgreens to smaller tech startups like Livongo and others, to the great hospitals and universities that we have right here in the city. Chicago truly has been leading the future of health.
That is 100% right, Tom. And, just looking at our past Chicago Innovation Award winners, we counted 48 of those winners have been in healthcare more than any other industry.
And as we emerge from the pandemic, it's becoming clearer than ever just how important innovation is to the future of health. Whether it's addressing disparities in health services across communities, or treating rare diseases, or leveraging technology to lengthen and also improve the quality of our lives, there is no limit to the impact that innovation can have on our health, especially as we age. And speaking of impact, I just want to give you a real quick snapshot of all the great things that we've been doing to make sure that our vision comes clear, which is innovation is for everyone. And we've designed our programming in such a way that we've got the Women's Mentoring Co-op, the Ageless Innovators, the Chicago Student Invention Convention, our newest program, The Ladder, which is aimed at advancing the careers of Black and Latina professionals. All of these are truly aimed at making sure that we're reaching out to all people in the community. And I just got to tell you one other thing. We've got two brand new initiatives that are actually in the works right now as we speak. So you'll see these coming out in the next few weeks. One of them is Turn the Page on Age, which is an initiative to combat ageism in the workplace. And the brand newest one is called the Climate Change Initiative.
Thank you, Tom. If you've got innovation in the name of your organization, you got to be doing new things all the time. And that's certainly what we're up to. And, besides all these programs, which you can get connected with those and be involved as mentors, as mentees, participants, separately, if you're looking to network and learn from Chicago's most successful leaders and innovators across industries, we offer a full range of events every month in person as well as virtual that you can come and participate in and get to know and meet lots of other innovators in Chicago and learn from a great array of speakers. Today is a great example. But before we introduce today's speakers, I want to recognize our year-round sponsors. And these are organizations that support everything that Chicago Innovation does all year round. They're great leaders in innovation themselves. And starting with our diamond sponsors, I want to thank SMS Assist, Wintrust, Walgreens, Dell and Intel, Molex, and Accenture. Our gold sponsor, Comcast Business. Silver sponsor, Vetter Price. Bronze sponsors, Crown Castle, Thompson Coburn, Antara, Forcheck, and Energy BBDO, and our media sponsors, WBBM News Radio, Intersection, Clear Channel Outdoor, and NBC Chicago, that all help us spread the word of what we do in big ways. Now, next up, we're going to meet each of our speakers today by asking them to first give a quick 3-minute mini talk about what excites them the most as it relates to innovation and the future of health. Following these mini talks, we're going to hand the baton over to Glenn Tolman, who's going to moderate a panel discussion. And we'll include a few minutes for audience questions at the very end. So I know you're all here. Let's get started. First, I would like to bring up our first speaker giving a mini talk, and that is Susette Mckinney, the Principal and Director of Life Sciences at Sterling Bay. Now, Suzette, for those of you who don't know her, she's a longtime innovator in the healthcare field. Let me just tell you a little bit about her background. So she's the former CEO of the Illinois Medical District, where she led 560 acres of medical research facilities, a biotech incubator, 40 plus healthcare related facilities, a number of hospitals, and much more. Now, she often discusses healthcare issues. She's been featured on CNN, ABC, the NBC Nightly News, among other places. And today we have her here to share her perspective with the Chicago innovation audience. So please welcome Susette Mckinney.
Thank you so much, Luke, and good afternoon, everyone. It's such a pleasure to be here with you today. As Luke said, my name is Susette Mckinney. I am the Principal and Director of Life Sciences at Sterling Bay. So one of the things that is clear about the city of Chicago, and that is all of the wonderful and amazing healthcare institutions and academic institutions that we have located here in our city. I think one of the other exciting things about the healthcare and academic community here in Chicago is all of the wonderful and amazing talent that is being bred within our healthcare facilities, but also within our academic institutions. And certainly Chicago has really been rising up the ranks among those markets that have so much entrepreneurial talent spinning out of universities. And again, Chicago is certainly no exception to that. One of the things that excites me the most is something that I am intimately involved in, and that is really doing my part and working within my company here at Sterling Bay to raise Chicago as a major life sciences market. One of the things that we've seen take place in our city for decades has been just the lack of space, proper space for entrepreneurial talent, especially those starting companies right out of their time in university. And we've seen a lot of this talent fleeing and going to the coast. And so it's really exciting to be a part of the initiative and an integral part of the work that's being done now to ensure that Chicago has the necessary space that we can maintain talent here in our city, but also attract new talent to our city. I firmly believe that that is one of the things that will help our economy grow, especially as we continue to do the work to emerge from all of the, not just healthcare challenges that COVID-19 has imposed upon our healthcare system here in Chicago, but also the economic challenges that our society has dealt with here in Chicago. I think what I'm most excited about with regards to the life sciences is what the life sciences are able to do for people living in disadvantaged or under-resourced communities here in our city. One of the things that COVID did was highlighted the extreme healthcare disparities that exist across several communities here in our city. And again, with my focus on the life sciences, I see an opportunity for people living in those communities, not only for their healthcare needs, but their economic needs as well. If you've heard me speak anytime previous to today, you will know that when I talk about the life sciences, I always talk about some specific statistics with regards to how the life sciences can help with economic development. The most probably significant of all being that 40% of life sciences jobs only require a high school diploma or GED. Obviously, those are not the PhDs or the medical doctors, the scientists, or the researchers that are conducting the research or starting these companies, but they are all of those positions and those roles that support the researchers and the physicians and the PhDs. Those could be people who are maintaining the facilities, people who are operating the retail establishments or the restaurants or the coffee shops, and any number of other support positions. But I see it as a way for us to leverage the life sciences to make a difference in people's healthcare outcomes indirectly through their economic outcomes. What we know is that when parents are worried about how they are going to put food on the table, they will not be as concerned about their own healthcare needs. But when you can solve for some of those economic needs, it alleviates some of the burden, if you will, to accessing care and managing some of those healthcare problems. I'm also really encouraged by the fact that COVID-19 not only highlighted these disparities, but so many of my colleagues and stakeholders across this city, from the government sector, the private business sector, as well as the nonprofit sector, have come together in ways that we just hadn't seen in the past to provide opportunity and to provide resources and assets for people living in vulnerable or under-resourced communities and assisting people with better access to care. I'm very encouraged by that. I'm excited to see how we continue to grow and emerge as a city coming out of COVID-19, and I'm looking forward to the rest of this discussion today. So with that, Luke, I'll turn it back over to you.
Terrific. Thank you, Suzette. As you can see why we asked Suzette to go first. What a wonderful overarching view of healthcare innovation in Chicago. And thank you for creating the physical places and spaces for innovators to be and work at, because you can't have the innovation if they're not places to be and innovate. So thank you for what you're doing at Sterling Bay. Secondly, we're going to invite up James Weiselman Shulman. He's the Global Design Lead for International Innovation at Cigna. Now, James helps to accelerate innovation for this health services company that has more than 180 million customer and patient relationships. And he joined Cigna in 2013 as the company's first in-house user-centered designer. And in this role, James leads a range of programs crafted to help Cigna gain a deeper understanding of stakeholders and consumers in the very complex healthcare ecosystem. So take it away, James.
Thank you so much, Luke, and excited to be here as well to take part in the discussion. And I'm going to share a few things that are really on my mind right now as I think about innovation in the healthcare space. You know, obviously, everything is sort of looked through the lens of what COVID has done over the last couple of years. And I think it's been exciting because in many ways, it's accelerated lots of things that have existed for a long time, but really sped up the pace and accelerated things in a way that we couldn't have imagined. And I'm going to touch on three things and then dive a little bit deeper into each of those. You know, first is the idea of a hybrid model. Now that we're all used to, apropos to this, you know, being on Zoom, being virtual, being in person, what does that mean for healthcare going forward now that we have more people using telehealth? The second thing is behavioral health and really how that is elevated during the pandemic, but what is that going to mean going forward? And I think the last piece of this is as we think about affordability. The last couple of years has seen a lot of rockiness in lots of markets, healthcare being one of those. So as I click back on the first one of these, which is really this hybrid model, we know more and more people were using telehealth as an opportunity, but telehealth isn't going to be the only answer going forward. We recognize that under certain cases, certain relationships, certain kinds of treatment, telehealth is going to be a great option going forward. And more patients are using it, more and more providers are using it, and it's really exciting. But we recognize and see those opportunities to really say, what's the hybrid model? When is telehealth a great opportunity? When is virtual care? When is home health going to be a great way to engage in the system? But when do we need to be in person? What are those opportunities that we have to consider to have that personal connection and that personal relationship? And so the future is going to be a hybrid one, not a purely digital one. I talked about behavioral health, and this has been, you know, we've seen a real change over the last couple of years, you know, obviously prior to COVID, increasing opportunities in behavioral health during COVID as more and more people were discussing and really bringing their mental and behavioral health to the foreground, which has been exciting. But the solutions haven't necessarily kept up the pace with those opportunities. And there's really, I think, going to be a continued growth in the behavioral health space, both in the acute sense of that, the stress that we're all facing, the idea how behavioral health affects chronic conditions, but then there's obviously acute behavioral health conditions, substance abuse or clinical conditions that we see more and more opportunity to do more to help patients treat and manage those conditions as we're going forward. And then the last piece is affordability. And obviously, you know, we see the rockiness of our markets, you know, unfortunately over the last couple of weeks with what's going on in Europe is obviously lots of pressure on affordability. And we've seen this in healthcare. And the big question is, how do we, as we go forward, create the systems and the opportunities to not only get patients the right kind of care, but get them affordable care that they can actually take advantage of. So I'm really excited to be here today to talk about some of these great opportunities and innovation opportunities we see going forward in healthcare. So Luke, I'll turn it back to you.
Great. Thank you, James. And thanks for giving the audience a teaser into those three big things: affordability, behavior, telehealth. It's really not telehealth versus in person, it's telehealth and in person, and how that works in conjunction with each other. So I know we'll talk more about that when we have the panel. Next up, it is my pleasure to invite up Anita Alemond, who's the Chief Transformation and Integration Officer at Walgreens Boots Alliance. Now, Anita leads the overall transformation for Walgreens, which I think all of us know it is one of the world's largest healthcare, pharmacy, and retail customers. I wouldn't be surprised if all of us could raise our hand and say we're customers of Walgreens, because it really does touch an amazing array of people. And by the way, one thing I want to mention, Walgreens was just listed number 33 on Fast Company's most innovative companies in the world list that was just published last week. And truthfully, it is largely due to the transformation-focused work that Anita right here herself spearheads. So please welcome Anita Alemond.
Thanks, Luke, and good afternoon, everyone. Thank you for having me today. Couldn't be more excited. Luke, I think you stole my thunder. I was going to start by saying just how honored I am to represent an organization that was named most innovative and actually #1 in the healthcare sector. So I'll say I'm most excited about the evolution, frankly, of healthcare from individual, sometimes siloed care professionals and channels to this growing focus on omni-channel interdisciplinary teams who are focused on whole person care and not just looking at individual dimensions. And I want to share some of what we are doing within WBA and Walgreens to make that come to life. So really our vision is to reimagine healthcare and well-being with a special focus on local care delivery. And I'll talk a little bit more about that as it does relate to some of the issues that have already been raised around health equities and just local disparities. And so I would say, we plan to do this three-pronged. One, creating greater access for every person in every community. And importantly, the specific needs of each neighborhood. And we'll talk a little bit later around how the zip code does matter when it comes to health outcomes and making sure that we're really tailoring solutions based on that and based on the individual communities. Second is, as you've mentioned, Luke, right, we are known for our capabilities in pharmacy, and we've done a fabulous job, especially during COVID-19 and our access and vaccination efforts. But to really take that and expand and provide an entry point to broader healthcare services and care delivery. So how can we do what we're already doing in pharmacy for a broader part as we expand into the whole continuum of healthcare? And third is to develop unique solutions that really address all dimensions: physical, emotional, and mental health. The COVID-19 pandemic demonstrated, really reinforced how critical a role America's pharmacists play every day. And they're the trusted source of neighborhood care in a strained and overburdened US healthcare system. Our ambition is really to leverage this and to build on this trust and expand relationships, especially around improving clinical outcomes and helping patients better manage their care. So within our core pharmacy business, we're building on the pharmacy of the future to support and enable that strategy with a focus on expanding the role of pharmacists to practice at the top of their license and free up the time for them to do that. Initiatives to drive health equity and access to care, and also reimagining retail through expanded health and wellness and mass personalization. Our newest segment, Walgreens Health, that was launched just this past fall, will bring, as I mentioned, the important access around whole person care to local communities. And the plan is to leverage that both in store, at home, in the doctor's office, via technology. And as part of that strategy, we've completed several investments in primary care, specialty pharmacy care, post-acute care, and home care. So what this tells you is that we're really invested in making sure that we impact the entire care journey, whether it's pre-acute to chronic care management, post-acute, and end of life, making sure that there's continuity within the capabilities that we have to offer. A great example of this is co-locating primary care offices within Walgreens pharmacies is an example of our expansion of our care model and making primary care more accessible, especially since 50% of those will be in medically underserved area. We plan to build on the existing services digital, and also newly launched Health Corner capabilities, which will provide in-person and virtual clinical and non-clinical services from health advisors, and they are licensed pharmacists or nurses. So really, alongside our payers and providers across the country, our goal is to unite that experience for consumers and patients by using technology, footprint, and partnerships to improve outcomes. So really excited to share some tangible examples of this in the panel. So with that, I'll turn it over to you, Luke.
Introductory notes. So next up is Nicole Leiter. She is the SVP Emerging Pharmacy Channel at McKesson. McKesson is a global leader in healthcare supply chain management solutions with over $238 billion in 2021 revenues alone. The company provides medical supplies and equipment, pharmaceutical distribution, and healthcare technology solutions to customers across the world. Nicole has the very exciting role of looking at new opportunities for McKesson as the company eyes the future. So please welcome Nicole Leiter.
Thank you. I was going to use this as like whatever Luke said, I'm just going to, try to make up how amazing he was making me sound. But apparently there were prepared talking points there. So it's good to see everyone. Good afternoon. I'm really excited to be back. I had the honor to help with this panel last year as well. So, and very fun to follow Anita. I did spend 25 years of my career at Walgreens, so have a fondness in my heart for the innovation and focus on patient care. The things that I am most excited about, and I get excited every day because I do have the opportunity, I have a really fun job, and I have an opportunity of talking to startups and innovators and people thinking about where the puck is headed in healthcare almost every day. So some of them were already mentioned, so I'll maybe touch on those, but won't belabor that, and then tell you where I'm also really excited that we haven't talked about yet. So meeting patients where they are, right? So this hybrid model, which drives accessibility, and there's a lot of factors that play into accessibility that I won't spend time on, but getting folks the right care at the right time, at the right place, and really using that to unlock the highest potential of our caregivers in the community. So of course I'm biased because I'm a pharmacist. So, and COVID really has done a nice job of shining the light on what pharmacists are trained to do and what we can do. We're not always compensated for it. And there's a lot of work going on there in a positive way. But I think technology can just further enhance that clinical expert that is at your fingertips in your community when you need them, that you have built a trusting relationship with already. So that absolutely passionate about. I think the other thing that I've really been thinking a lot about lately, and I'm very excited, is this democratization of patient data. So we have a lot of data that I don't think anybody would argue with that, but it's very disparate. It's in different systems. Systems don't talk to each other. It's not simple to get them to all speak the same language, but there have been some, the Cures Act, if anyone is familiar with that, probably you are, I think has really unlocked the potential for us to bring it together. We really need an accurate, comprehensive, longitudinal view of patient data in order for providers to make better decisions. And what I mean by better decisions is if you had an MRI last year and we can't find it, we do another MRI. Does that make a lot of sense? Not for the overall healthcare system, not for the patient if you have, a deductible or anything out of pocket, nor is it just, it's not a good use of anyone's time. So hoping that can be pulled together with insights and analytics to lower total cost of care, which in turn I hope would translate to affordability. So I'm just excited about it. I think as a practicing pharmacist in my past, I'm not such a good one anymore. If I would have had more data at my fingertips, I could have provided a higher level of care for the patient. So I think there's a lot of energy in the space. I'll be really excited to see who solves for it and how that comes to life. But that is where my energy is focused today. So excited for the rest of the conversation and glad to be here again. Luke, I'll give it back to you or Paul.
All right, thanks so much, Nicole. So next up is Paul Chaffin. Paul is the SVP and President of the Medical and Pharmaceutical Solutions Division at Molex. After 15 years of leadership at Ecolab, Paul joined Molex for the opportunity to help millions of people lead healthier lives. With nearly 8,000 associates in 26 facilities across 10 countries, the impact of Molex's medical and pharmaceutical division continues to grow with Paul at the helm. Please welcome Paul Cheff.
Thanks, Paul. And I hope you've already sent a note to Luke and let him know he's buying next time. So, hey, the area that I'm most excited about is actually the advancement in-home diagnostics. And I'm not just talking about COVID tests. I'm talking about a wide range of different types of diagnostic tests. For example, imagine being able to quickly and reliably diagnose from the comfort of your own home whether your child simply has a cold or something more severe like the croup, the flu, RSV, or COVID, with a simple test that gives you both rapid and highly accurate results. Or was it something you ate last night? Really? Or maybe something more severe like norovirus? Or how about an individual knowing whether they've acquired an STD and then being able to seek the appropriate treatment all online and discreetly? The advantages of in-home diagnostic tests are significant. For starters, early detection means better treatment and less community spread. A secondary benefit is that many of these tests will capture the results via an app, with individual anonymous results being uploaded to a database. When all of that individual data is aggregated, public health officials can then see how a particular disease is progressing in a given community and develop targeted interventions in the early phase of an outbreak. Now, enabling the advancements is the convergence of a number of technologies, including novel reagents and other methods for detecting the presence of pathogens, more and reliable and less expensive batteries and software, and connected devices and data aggregation and analytical tools. Think about the power of AI in this space. Now, the future of in-home diagnostics won't stop with respiratory or GI viruses. Think about if you've seen the Cologuard product. We manufacture millions of these kits for a company called Exact Sciences, who's the maker of Cologuard. Cologuard detects changes in DNA that signal the presence of colon cancer. Approximately 1,500 Americans, 150,000 Americans will be diagnosed with colorectal cancer this year. And most cases are preventable if it's caught early. So if you're over 45, you should order your Cologuard kit today. And in the relatively near future, there will be all sorts of different home diagnostic tests that help you to personalize your diet based on your specific microbiome, develop preventative healthcare plans based on your individual genomes, and conduct frequent and non-invasive blood testing and heart monitoring for chronic disease management. Better healthcare is going to start with better and faster diagnostics, and I believe we're on the sea change in this space, and that it'll have a lasting impact on not only the well-being of individuals, but communities as a whole. Thanks, Paul. I'll turn it back to you.
Okay, thank you, Paul. I think that I'm back. Can people hear me?
Hey, we can hear you.
Okay, fantastic. You know what? I had a big cheeseburger for lunch. I haven't gone to the gym in a couple of weeks. I think the universe is saying, Luke, what are you doing emceeing a future of health event? So I got kicked off, but I'm back here to introduce our final speaker, who will also be the moderator of the panel, and that is the one and only Glenn Tolman, who is the CEO of Transcarent. And it is hard to succinctly summarize what Glenn's done in the healthcare field, but here it goes. So as CEO of Transcarent, Glenn is leading a new and different health and care experiences company that has already raised around $300 million since its founding in 2018. And prior to Transcarent, Glenn founded Livongo in 2016, which he sold to Teladoc for $18.5 billion, billion with a B, just last year. And he's also run 2 other public companies that have changed the way healthcare is delivered, including he was the CEO of Allscripts, as well as the CEO of Enterprise Systems. He's also the founding partner of 7 Wire Ventures, which is one of the highest returning VC funds in Illinois. It's focused on digital health companies. He's invested in many great local companies. And finally, Glenn is also an amazing force of positive change towards finding a cure for juvenile diabetes and other diseases. And, just one last thing I'll say about Glenn. I've also been told that he's got some pretty solid magician skills, but I think we're going to save that portion of Glenn's talents for another Zoom event. Today, it's all about health. So please welcome Glenn Tullman.
Thanks very much, Luke. First of all, I wanted to just thank you and Tom and the team for putting together a great panel. I'm super excited, not only about asking the questions today, but also listening to the answers, because we've got some really talented folks on. And so the initial task, I guess, in 3 minutes was, what are you most excited about? And a little bit of an introduction. So I thought I'd start there. In terms of what I'm most excited about, it's really consumers taking charge of healthcare, because I think that a lot of the challenges we face are primarily because consumers are not in charge. And this is not about, focusing on consumers, because that still kind of gives you this sense of somebody else is focusing. It's putting people back in charge. So that's what we're doing at Transcarent, my new company. And Transcarent, as you mentioned, is really about creating a new, different, and better health and care experience that puts people back in charge of their care. When I talk about that, I always talk about being different, because if you think about our experience as consumers, in many cases, we've been told what to do. We don't have healthcare on our terms, and yet everything else that we see in the economy today puts us in charge. Uber allows us to talk directly to a driver. Travelocity allows us to book our own tickets, and on and on and on. And if you survey people about healthcare, they'll tell you that healthcare is more confusing, more complex, more costly than ever before, and it's getting worse. And so what can we do? Well, at Transcarent, what we've done is we've taken the most common activities that people have, and that is what we call everyday care, talking to a physician. We do it in 60 seconds, 24 hours a day. It's booking appointments with your local health system. You transition from there to medications. We find you the lowest cost medications. From there to getting care at home, or the best place you can get it, getting surgeries from high quality providers. And last but not least, when you're dealing with something like complex care, making sure that you're getting the best care and the best answers. All of that is on an app. It's all on your phone. It's easy to use. And of course, there's no cost to it. It's sponsored by employers. So it's a very new, very different idea, but it's really focused on how do we put people back in charge of their care. And if there were two ideas that I think are going to redefine healthcare in the future, it's one, putting people, consumers, all of us in charge, and two, alignment with the people who pay for care. That's all of us. We now pay for about 40% of care, paired with the employers and in some cases the government, who are the other big payers of care. So that's a little bit about my take on this. But what I'd like to do is hear from everybody else on the panel. So I'd like to invite the panel back to, if all of you can log on. And I'll kind of start with an interesting question. Healthcare used to be a lot simpler. All we did was ask our physicians what we should do. And we diligently listened to them, to him or to her, and in many cases to our pharmacists, who I know there's some on the line, who they were really the most contact we had in the healthcare system. Our pharmacists, we saw them more frequently than ever. And yet today, the good news is we have more information than ever. We saw this in the pandemic. And the bad news is I'm not sure we're using it appropriately. So I want to run through the panel really quickly to get us started and say, what do you think we should do to better manage this amazing amount of information that we have? Clearly, the pandemic showed us how challenging it can be to not do that. So let me start with Suzette to just answer this question of how can innovation better enable communication around health? What should we be doing differently? So Suzette, maybe kick us off if you can.
Yes. Thank you so much, Glenn. Well, first and foremost, I think, and this started really thrust into the spotlight, if you will, with COVID. I think telehealth made the opportunity for patients to communicate with their physicians much easier. It certainly eliminated barriers around appointment backlogs and transportation and things of that sort. But I also think that moving forward, hospitals, healthcare systems, even private physicians' offices can engage with technology in a way and provide platforms through technology that will enable their patients to have a better experience in that communication. Even something as simple as a patient interface app on the cell phone that will allow a patient to send a text message to the provider to either log a complaint, some sort of health complaint, or seek advice. The ability to upload photos and things like that to better give their providers an understanding of what they're dealing with. I think we will begin to see a heavy shift away from patients coming into hospital emergency rooms and a shift more toward utilizing technology to have more free-flowing communication with the provider.
So Suzette, I want to have a whole discussion with you about that, but I want to summarize this. It may be incorrect in saying, you're kind of saying use the technology, but allow people to more directly communicate with their physicians and maybe not let them go out on the wild west of the internet and grab whatever they find. But James, jump in here. What do you think? Because we've got more information than ever, and it doesn't seem like it's helping us.
Yeah, no, and Glenn, I'll build off what Suzette said, which is how can we better put, the patients and or caregivers, if you're taking care of a loved one, put them at the center of the tools and the technology and the experience and the care that we're delivering. Too many of these systems have been built with the patient almost removed from them. And so how can we use this great new technological tools that we have in our midst, whether that's the actual physical stuff, whether that's AI, whether that's, VR and AR, all these things are coming to life, blockchain, but how do we use them by really putting the patient first and driving from what their needs are in the times and places when they exactly need those things, so that you can remove the extraneous information that's too easy, Glenn, as you were talking about, right? Dr. Google, right? Well, what if we don't need Dr. Google anymore because we're getting exactly the answer to the question that I need in the moment I need it at a level that's appropriate for me, what I understand, where I am in my journey, what kinds of questions I may have. And I think that's going to be really, as we look to the future, is going to be that magic sweet spot of being able to get to that place that we're able to drive those kinds of solutions and simplify the communication for the people who need it.
So I will do a little ad for my former company, Livongo, here by saying that at Livongo, we would occasionally call people and we'd say, we're calling, what do you need right now? And they'd say, you're calling at the perfect moment. And we knew it was the perfect moment because we knew what was happening in their body. We knew they were either low or high in terms of blood sugar, and we could be there for them. And I think that's a little bit of what you're getting at, which is how do we use this technology to deliver the right answer at the right time, in some cases before we even know it. Anita, you're kind of this interesting person that has access to thousands and thousands of pharmacists. And on the other hand, you've been given this task of how do you drive innovation to make them most effective. And you've been right in the middle of the COVID pandemic as well. So what do you think? How do we make sure, because people have always relied on their pharmacist for getting the right information. What do you think?
Yeah, and I think there definitely is a need to continue that, right? I think, as we said, it's so multidimensional, and a person's unique needs are, it might be leveraging Dr. Google, it might be your pharmacist, but for me, the core of it, as I would think about it, is the data. And I think someone else raised this. I think we have so many interoperability issues. And if we could create an ecosystem and an environment where we really had all these interactions and data was centralized to some extent, and imagine the provider knowing the discussions that a patient had with their pharmacist, if they could look at the data and see, oh, they're not taking their medications. And by the way, it's because of transportation or literacy or financial. That information we can secure in one channel, but we're not necessarily distributing it across the care model and the continuum. So I would say that plays a really key role in ensuring that we are sharing data across the care delivery model, and we can leverage those patient interactions to better care.
Great. Nicole, your thoughts?
Yeah, so it's interesting because a lot of it I wrote down personalized, targeted, relevant, trusted, right? And so I think there is either a lack of data, and without information, people assume the worst and then they go to Dr. Google. So that's not helpful. We've almost tipped the scale so far the other direction that there's too much data and it becomes noise. And so how you get it more targeted, and the example about Livongo is perfect, right? So any sort of remote monitoring that can give us signs and signals as to what information or intervention is relevant at that time, I think we just need more of that.
Great. And last but not least, Paul, bring us home here.
Yeah, I think so. Agree with everything that's been said. The one thing that jumps out at me when we have this part of the conversation is kind of the need to do a classic customer segmentation, right? Because this is not a one size fits all answer. And I'll give you my personal example. So I've got a couple of young adult children that chuckle when somebody asks them who their primary care provider is. They don't have one. And then I've got parents who are pushing 80 with chronic underlying health issues that still struggle to text a picture to themselves or their kids. So I share that because I think we got to be careful when we have this conversation that we recognize there is a huge continuum of people, and we've got to be more targeted in the solution to meet them where they are, as somebody said.
Great. Well, I think this is one where, and it was a great starter question because I think everybody added a piece of it. And I think we see a lot of different organizations getting one piece right, but not the next piece. So as Paul just said, if you get part of it right, but to the wrong audience, you might as well not have spent the time. And that's the tricky part of this. So that leads into a great question about healthcare reform. We have been working, some of us, and I won't give you how many years I've been doing it because I might be the senior person on the call here, only by age, by the way, not by intelligence. But that said, we have been working on making healthcare a better experience, improving care, and reducing costs for 25 years, maybe. And yet today we have, as I mentioned in my introduction, people who say it's more confusing, more complex, more costly than ever. And here's the killer. And it's getting worse, not better. People do not see us as improving care. And yet now we've added all this technology. So we started off with payers saying they were going to do it. They didn't do it. Then we added technology. That didn't work. Then we added navigators. And navigators said, we'll help you navigate through this broken system. That didn't work. People said that's just another step with no ROI. So now we're at this point. And I guess the question is, what do each of you, and I'll start, Anita, with you, what do you think is the most urgent change that we need? And how can innovation solve for this? And before you answer, we had one question come in from Dan Heck, who also tried to help Luke get back online. So thanks, Dan. And he said, is the profit motive helping or hindering our push forward? So I guess the question is, what's the most urgent change, and can innovation be helpful? And how does that relate to profit, nonprofit?
Yeah, what I would say is that there's various things we can think about. The most immediate, at least from a perspective of how do you change both cost of care and the profit pools and have better outcomes, is really the migration towards value-based care. I think we've been talking about value-based care for a very, very long time. We've had reform in multiple areas in healthcare, but not necessarily that, right? So imagine a time where you're actually paying providers based on the outcomes and what they're able to see in terms of disease progression and managing conditions, and it's not based on the frequency of those interactions. So I would say the more the focus is, we keep saying this, whole person care, getting to payment models being around value and decreasing health outcomes. I would say that is probably one of the most important reforms needed. And then the secondary piece we can say is, how do we solve for health disparities and inequities, because those do exist and they're a big, big part of what we spend in healthcare every year. So that's a big area as well.
Well, first, thank you. We should do no call without mentioning health disparities and our challenge as a country and as individuals to address those. We can't be the country, I firmly believe, we can't be the country we want to be when 2 or 3 zip codes away in Chicago, there's a 10-year life disparity. So we can't, but I want to put you on the spot. I want to come back to you and put you on the spot because Dan said, can you do that? Can you get to value-based care when a lot of people, I'm kind of adding to his question, when a lot of people make money by filling up beds and by, requesting more and more care. I was once with a hospital executive that said, my goal is to make sure every bed in my hospital is empty because the community is so healthy. And someone jokingly said, and then you would lose your job. And in fact, that is the conundrum that we face. So can you do that? You're from a company that's a profit-based company. I happen to love that, but that's the question that a lot of people are asking.
Yeah, no, I think it can be done. I think it goes back to, are you aligning incentives appropriately? And if you align incentives based on the value you're providing and the outcomes you can, I think it's a win-win for both sides. Or you can make profit. And by the way, you in fact are delivering better care and improving outcomes and decreasing the overall cost. So I think the payment models, the incentive alignments all have to be together, and you're able to do both, frankly.
So we have to push that. Nicole, you're in a similar kind of space, which is in some respects, the more you do, the more money you make. And how do we get to value-based care?
Yeah, so it's funny because I was thinking back to my not so distant days of owning a very large P&L at a very big retail pharmacy company. And it's hard. And so I don't want to underestimate. It is very difficult as the incentives start to move towards value-based care, which I think we all are conceptually aligned that that's where we need to go if the US healthcare system is going to make it. But when you're quarter by quarter publicly traded and you have others that rely on you, to hit certain numbers, it's hard. And so what I would say is the winners that will prevail are the ones that are willing to stop doing things, even though they might make a little bit of money today, stop doing things that are not a part of that solution and focus your energy on the innovation. Yes, you have to make money to invest in innovation. And I think actually, and I'm not as close to some of the strategic decisions that some of the big companies are making, but I do see with Walgreens as an example, I think the refocus on US healthcare, this is where we're going. We are going to make a difference. And I think you have to get more narrow in order to do it. You can't be all things to everyone and be a publicly traded company and expect that you can weather the storm of fee for service to value-based care. And it's no different for, where I work today. And actually wholesale margin is, I didn't actually think there was anything lower than pharmacy margin, but it turns out wholesale margin is much lower. and so it very much becomes a volume game. And it is, it's interesting. And frankly, I'm very proud of McKesson for investing just in my team in general, right? To say, hey, we need somebody thinking about where things are headed. Tell us what we should do, how we should play in this space, and we'll try to figure out how we get there. I was going through my head. I was population health management, value-based care. I think I've been hearing these terms since like 2008. I think we are finally at a breaking point where we're going to be able to unlock it and get aligned incentives, but it's not going to be a smooth road, in my opinion.
And last comment on this one, James, what do you think? Can we get there?
It's not going to be an easy road, as was mentioned. Obviously, I think obviously be in line, as was mentioned, Anita sort of talked about the misalignment of incentives, right? And I think that's going to be a real question of how do we, readjust how we think about the incentive structures that currently exist today. And there's going to be growing pains. I think as we move from one model to another model, and it may be that some players who were relying on, to your point, Glenn, right, filling beds, that may not be the answer in the future. It may be preventing people from sitting, being in beds becomes the new incentive model. And we move from a, treating disease by as many tests as you can do models to what are the things we can do in order to prevent the, either an illness from happening or prevent progression of chronic conditions, and really sort of looking at it systemically to say, how can we bring that back further? How can we as a society, and it's not going to be, one entity, one institution, one employer, one company that's going to do this. It really has to be collectively, because we're not able to, I think, as Paul was mentioning before, solutions can't be one size doesn't fit all. There's going to have to be a lot of different solutions that are going to work together, but all have this aligned incentive toward how do we, get back to a ounce of prevention is better than a pound of cure model.
Yeah, well, I agree. And I would ask that each of the panelists and the people on the call start to think about that in our respective businesses, because it's only going to be a team effort and it's hard to lead. In some respects, there was a speaker I heard once named Jeff Sauls, and he said, sometimes you have to leap before you look, which was exactly the opposite of what we were trained to do as kids. And that's where we are today. We have to assume that we can do the right thing. Let me switch gears. And Suzette, I'll ask you kind of a fun question. I was at the Lake Nona Innovation Conference recently, and they were speculating how long we thought we could live as individuals with healthy lifestyles, with new medications and the like. And then secondarily, one thing is living longer. Another piece of that is living healthier and better. So it doesn't help us if we all live to 120 and we have Alzheimer's and we can't remember the last 15 years. So give us your perspective on that. This is just kind of a fun one. But, I think a lot of people wonder about that, particularly in light of our health system as it exists today.
Sure. Well, thanks for the question, Glenn. I think, presumably those of us who are well-versed in how to access our health care and have the resources that we need to do things like engage in regular exercise, eat healthy, whole foods, that will help us to be healthier. Presumably, we will have longer life expectancy. But I would also say, that requires us to be cognizant of what healthy behaviors truly are and to engage in those healthy behaviors. It doesn't help to have all of the resources that you possibly have when, you don't regularly exercise or don't eat healthy foods. But I think, one of the things that I would like to touch on that is much more concerning are what can we each be doing to help those among us who live in communities where the life expectancy is much lower than the communities where we live. And, I've often heard people say, well, what can I do to impact or improve someone's life expectancy? And, personally, I don't think it's that difficult. One of the things that we learned during my time at the Illinois Medical District was some of the reasons behind the decrease in life expectancy in certain communities was due to things like lack of access to jobs and education and poor neighborhood structure. Collectively, those things that we call the social determinants of health. And I think folks would be surprised at what you can do on an individual level to help improve that. And I think it just starts with looking at where you are and what type of influence do you have that can help address some of those social determinants. I've seen examples where hospital leaders have come together and collaborated and spoke to, the larger medical distributors and said, we've ordered our goods, our products from you for years, but now we want you to allocate a certain percentage to a smaller, perhaps minority-owned distributor. What does that do? It helps that small business grow. It enables that small business to employ more people, giving them access to employment, and thus enabling them to have a better economic standpoint so that they can improve their life expectancy. So, for the sake of time, I'll just use that one example, but I think that there are many things that we can all do in our individual places and spaces to help improve life expectancy in areas that where it's not as great as where we might reside.
Well, and I'll add one more, and that is we launched during Black History Month an initiative to have companies that have lots of assets actually invest and put some of those assets in Black-owned banks. If you look at Black-owned banks, what you find is they invest in Black-owned businesses and underserved communities much more. And we thought for all the companies, particularly in the healthcare space, they would just allocate 10% of that money, we could actually drive a lot of change. So the goal was $1 billion of investment in 5 years, and we're already on the way. And I'd love for anybody on this call to join in and move some of those assets from where they are today into Black-owned banks and join us in that initiative. Let's switch gears just for a moment. As we look back at the pandemic, that I hope I can say we've come through. I realize though we aren't completely through it yet, and I want to be very sensitive. We'll look back 10 years from now and we'll see the loss of life, the tragic loss of life. We'll look back and see the economic damage that was done. And I think the most longstanding issue will be the mental health challenges that we've created, the uncertainty we put into people's lives and the like. And yet, I think we've seen some hopeful signs in terms of the benefits that we've seen from digital healthcare. And so, I'd love to get the perspective, and maybe Paul, start with you on what we've seen, the progress we've seen in digital mental health. And we've also seen some of that progress in both underserved areas. And there I'm talking not just about inner city, but also rural, because people who couldn't get access to care, we've now demonstrated that they can. So love for you to talk about that, Paul, in terms of mental health in particular.
Yeah, thanks, Glenn. My perspective is this was a crisis before the pandemic, and the pandemic only accelerated it, unfortunately. So, and I think if there's a silver lining to all of this, we're now talking about it openly, which we weren't even 5 years ago. So it's at least being acknowledged that this is a chronic disease and a societal problem. I also think we're starting to talk about the underpinnings of it, right? And it goes beyond the pandemic, whether it's social unrest, whether it's the political chasm we have, and whether it's social media. We're starting, and I think it's just the beginning of starting to really understand why is it people feel so disconnected and so isolated, whether you're urban, rural, suburban, old, young, whatever it is. So I think that's the healthy. I think, to your point, this is where I think technology can play a huge role. And probably have a immediate impact. And we're starting to see it with apps. We're starting to see it with communities. But there's a lot more that needs to be done there. Then I think there's even more that needs to be done with healthcare professionals. They need to be educated more. They need to be able to intervene faster, see it. That includes whether that's social workers in the schools. I think there's still much more that can be done to catch it early with individuals. And take the preventative steps that will ultimately lead to better outcomes for people. Yeah,
I couldn't agree more. I mean, I love the fact that we're talking about mental health openly, and I think as you've called out, it's almost beyond mental health, because there's some societal health issues that we also have to start to address, and that they feed off each other. We have to get back to this sense of one community, one healthy community. Anita, any thoughts on that?
Yeah, no, I would say absolutely, completely agree. The other piece I would say is while there is focus, there is attention, we have tools talking about it and making sure that mental health, behavioral health is a key part of how we just manage health, right? So if you're thinking about chronic care and disease management, I would say that is an underlying comorbidity in most conditions. And so not just to isolate it, but to really think about it in the whole continuum of addressing it. So I think it goes back to whole person care while you're thinking about physical care, making sure this is a key component and not just isolating it when you think you need it. So I think this is the importance of, yet again, not disparate areas, bringing it all together, ensuring the healthcare professionals and workers are trained and have the ability to really talk about it, even if it's, you're just picking up your prescription. That is a great opportunity to be talking about it as well. So just full dimension to care.
Agree 100%. There's a few questions building up and I want to get to them. Before we do that, I want to do a quick round robin. And that is if we go through this group, and I guess the question I would ask is either what's one piece of advice that you would give folks on the call, or what's one technology, service, or the like that you think is the least known about. So what's one hack, if you will, one life hack that you would suggest? So not to put you on the spot, Nicole, but why don't we start with you? Either a piece of advice or a life hack that you've used to make yourself healthier and more productive.
I don't think I've found the life hack yet, but I'll keep working on it, or hopefully somebody here will have really good advice. One piece of advice that I find myself saying a lot and practicing is not assuming that any process in healthcare is the way it is or has to be the way it is today. And so if it feels like it could be done better, if it feels like it could be simpler, it probably can. And I find that there's a lot of assumptions of, well, it must be a regulation, or it must be a this, or so continuing to be very curious and asking why, and really getting down to, does it have to be that way? Or is that the way we've always done it? And if you put the patient, truly the patient in the center, is that the right way to do it? And if the answer is no, just keep going after it and don't give up.
Great. Suzette?
I think the one piece of advice that I would give to folks on the call, first and foremost, be an educated and a knowledgeable consumer. Just because you get one piece of advice from one resource doesn't mean that, that's the only piece of advice. I think it's just very important that we be as educated and knowledgeable as we can around our own healthcare. And, as I age, I have many friends that talk about, different aches and pains and things like that they're feeling, but oftentimes they are nervous and afraid to talk with their healthcare provider to figure out what it may be. And I think just because of, our diets in this country and our lack of optimal physical activity, so many health concerns can be alleviated or prevented, if you will. And so I would say, if you're experiencing a challenge, go check it out. Talk to your provider, try and figure out what it is, because it's better to be in the know than to have to deal with a situation that's gotten worse later.
Great. I agree. And I push second opinions. I see so many people getting surgeries and doing things without a second opinion. If you can imagine getting your body cut open without asking a simple question, and we have to open that up. James?
Yeah, the thing that I've been thinking about lately is what I'm thinking about, right? So pay attention to what you're paying attention to, and that will sort of help you see where you can refocus. And I think, we often talk about, how we spend our time is a choice that we all make. And, people often talk about, I don't have time to exercise. I don't have time to eat. I don't have time to work on that project at work. Well, do you really? Or what are you paying attention to? What matters to you? And I think there's an opportunity both in your personal life to say, what's important? Where am I putting my time and energy? And in my work life, what problems am I solving at work that are going to matter to the patients and members and customers and people that we want to solve problems for. And so I think that opportunity to sort of step back a little bit and see what you're paying attention to, and then refocus if you need to.
Paul, thank you, James. Paul?
Yeah, and I think I'm stealing this from one of my esteemed panelists from the conversation we had earlier, because I thought it was a great way of encapsulating what I've been thinking about, and that is sitting is the new smoking. So I don't know if it was James, somebody said this, but it encapsulates, for me, it was first time I heard it, and I was like, that finally encapsulates how severe our sedentary lifestyles are, both for our physical well-being, but also our mental well-being. So, you know, I think we talk a lot about it, but I think the pandemic certainly accelerated this. This was another trend underway. And you look at children and you look at the rise of type 1, type 2 diabetes, you can see it there too. So movement. And then the life hack, this goes back to what I was talking about on diagnostics, that Cologuard kit for those of you over 45, if you do that, you can avoid the colonoscopy. So I'll leave you with that thought.
And Anita, last but not least, and then I have one, we'll see if you get it.
Yeah, you know, I would say the important advice I'd have for all of us really invested in the future of healthcare is collaboration. I'll start with that. None of us here can do it alone. So, you know, how are we collaborating? We've heard people say, put the patient in the center, that's another, like, how are we thinking about caregivers? So there's so much around coordination and collaboration that's really important from a healthcare delivery. I would say on a life hack, one that I am striving my best to get to is sleep. And I do think that, you know, getting a good amount of sleep and really being able to decompress helps me. So I'm on my path to trying that.
Well, I was going to, that's a great one. And the questions in chat was blowing up with sleep as one of the ones that we're not getting. And, you know, the one that I would add is connection. And I think that we all need to be more connected with each other. We all need to laugh a little bit more. And, but those connections are critically important. And I think especially a lot of the mental health is related to, we are social animals, and yet the last 2 years, we've been told that we're dangerous to each other and we have to wear masks. And I think that's really hurt. And I think we've got to work hard to get reconnected to people. So, so I appreciate all that. I want to jump to some of the questions. One of the questions that I'd love to, you to jump in on is, and I'm paging through here. This one will be interesting to at least two of the panels. It seems impossible to think that pharmacists are in a position to offer more assistance and guidance to consumers. They already are so overworked and overwhelmed. So any thoughts on that? And Nicole, you want to jump in or?
Yeah. Yeah, I was going to let Anita take it, but I'll jump in and
I was going to call on her next.
No, it's hard right now. It's really hard. I think it will get better, I guess is what I would say. So if I were to think about, as a pharmacist, we have wanted this kind of notoriety and we have wanted this understanding of the value that we provide for so long, but it happened so fast in a way that we couldn't plan accordingly, right? And so you couldn't anticipate this coming, and it's been really challenging, not just for the workload on the pharmacist, but the shortage of technicians, right? There's a lot of things going on. What my belief is that if we continue to innovate and leverage technology and really automate all of the things that are not value added that can be done, there is plenty of work for everyone, and it will be more rewarding work as that shift to really automating the dispensing, the commoditized parts of pharmacy that make it so challenging today. So I know if I'm envisioning myself, which I did many, many years of, you know, a room full of pharmacists saying like, that's super cute, Nicole, but I'm dying over here. Like, I think I would say, we know, we all know, we know it's been really hard, and we know that you need a little bit of reprieve, and you have the support at every level within the healthcare system that you could ever imagine. So hang in there and know that there are a lot of us really fighting to get the balance back, but skewed more towards where you really bring unique value versus some of the dispensing and other things that fall on your plate.
Agree 100%. And that was so good. I'm gonna skip to one more question. I think that's all we have time for. And that is, the question is, there is a huge technical potential in many global tech companies. How can we push these companies to invest in healthcare solutions? So maybe James jump in on that, and then we'll see if we have more time.
Yeah.
Maybe give us a quick one and we'll bounce that around to end up, maybe Suzette after James.
Yeah, I mean, I think you're right. There is so much potential out there. I think part of it is recognizing the market potential of the healthcare ecosystem. As we were talking about, how can we reimagine what the future of healthcare starts to look like? And if you're a tech company and you can build and deploy technology to solve some of these problems, there is plenty of opportunity to enter the healthcare market. As complex and convoluted and crazy as it is, that often leaves a door open for new entrants that we see all the time. And so it's an exciting time to be in the healthcare technology ecosystem.
Agree. Suzette?
I would agree with that as well. And I think it's an ideal opportunity for governments to participate in healthcare in the right way, in a more positive way. And that is in the form of incentivizing entrepreneurs who are starting companies that utilize technology to improve healthcare delivery. I think is a great way to assist these new companies with entering the healthcare space.
Well, and you're not giving yourself and your organization enough credit, because I think we are seeing new entrants in the space that are starting to say, hey, we need spaces to create these new entities and the like, exactly what you're doing in Chicago and elsewhere. So thank you for that. Well, I'm going to turn it back over to Luke. I think that, it's unfortunate because this could go on for a while. And you see me leaning over, I'm taking notes of all this good guidance that I'm getting, especially some of the life hacks and some of the great answers to the questions. So thank you all for spending a little time today. Thanks to the audience for listening. And I'm going to turn it back over to Luke, and we'll see. If not, we'll see. Luke, you're in?
I'm here, Glenn. Thank
Okay.
you. I took 2 pages of notes myself as well, and I agree. This easily could have gone on for much, much longer. And Glenn, I want to thank you for doing a terrific job leading today's session, and to Suzette and James, Nicole, Paul, and Anita. Outstanding panel. You 6, I can't imagine a better 6 people we could have invited for this today. So thank you, all of you. And really, as Tom said at the outset, there's no topic more important than our health and well-being. So we are all lucky to have each of you thinking about, ways to make the rest of us healthier, the recipients of your innovation, healthier and happier people, by you coming up with the new products and services and experiences that's really bringing innovation to people and communities in all corners of the world. And I also want to thank our audience for tuning in, helping make this Chicago Innovation community the vibrant and diverse community that it is today. And looking ahead, we've got a lot in store for 2022. And since we are finally, though, like you, Glenn, I'm crossing my fingers, finally getting on the other side of the pandemic, but it sure seems like we're getting there. We're very excited to be ramping up again with more in-person Chicago Innovation events, starting with one of our favorite events of the year. It's actually just next week. It's our Celebrating Women in Innovation event on March 23rd at Wintrust Grand Banking Hall in downtown Chicago, though we're going to continue the virtual events too for the audience that wants to engage that way. And the next one is called the Employee of the Future, which is really looking at the evolving future of work on April 19th. So in closing, thank you all for tuning in today. Thank you again to our amazing panelists and moderator. And in the spirit of today's event, eat healthy, exercise, wash your hands, 20 seconds. Let's all live to 100 so we can celebrate at each other's birthday parties. And until then, hopefully we'll see you at more Chicago Innovation events. So thanks so much and take care, everyone.